We're now going to move our attention to the male reproductive system. Here again we see a model with a lateral view. So just for orientation, this is the anterior part of the model, this is the posterior part of the model. We see the penis and the scrotum with the testes within. Just for orientation again, we've got the urinary bladder here in this model. We see the anus and the rectum here, vertebral canal, sacrum, pubic bone. So we're going to go ahead and remove some parts of this model, but just so you have your orientation, that's where we are. So again, with this model, this is the penis. The epididymis we see here, so it's this kind of comma-shaped structure that lies on top of the testi. The corpora cavernosa and the corpus spongiosum, which is toward the bottom of the word list page, are both tissue that makes up the majority of the structure of the penis. So the corpora cavernosa we see here, and the corpus spongiosum we see here. So making up the glans penis, or the head of the penis, and then also that corpus spongiosum is going to be lining or covering the outside of the urethra. As I mentioned, the glans penis, so the glans penis, or the head of the penis, is this distal portion of the penis. The foreskin or the prepuce is cannot be viewed on this model. The foreskin or prepuce would be a skin-like covering that covers the glans penis. That tissue is often removed for hygiene purposes. The next structure to identify is the scrotum. So the scrotum is this skin covered bag that contains the testi, which is the next structure on the list. So this is the testi here. A male has paired testes, but again, since we're looking at a lateral view, we are only seeing one. The next structure to identify is the rectum. So as I pointed out here on this model, this is the rectum. The bladder we see here. Going to go ahead and remove part of this model so we can take a better look inside. So again, here we see the urinary bladder, or the bladder. Sperm is not viewable on this model. I already pointed out the corpus spongiosum. So the next structure to identify is the seminal vesicle. Seminal vesicle on this model can best be viewed with this piece kind of back intact here. We see this gland right here is called the seminal vesicle. The next structure we're going to identify is the urinary bladder, which I've done a few times. So again, here's the urinary bladder. This right here is the distal portion of the ureter, which again would be draining urine from the kidney, and the ureters are going to dump their urine into the bladder at kind of the posterior aspect of the bladder. Let's identify the vas deferens, or the ductus deferens. The vas deferens is a tube, a muscular tube, that is going to carry sperm from the epididymis to what's known as the ejaculatory duct. So the vas deferens or the ductus deferens lies within this structure here. This structure is known as the spermatic cord. So it is a cord-like structure that contains blood vessels, nerves, this vas deferens or ductus deferens. That vas deferens that's carrying sperm is eventually going to deposit that sperm into the next structure, which is known as the ejaculatory duct. So as we take this part of the model off, I'm going to have to kind of tip the model a little bit so we can see it better here. This is the ejaculatory duct. So the vas deferens or ductus deferens is going to be depositing secretions that contain viable sperm into the ejaculatory duct. When I tip the model here, what we see right here, this is known as the ampulla of the vas deferens. So this here is kind of the terminal portion of the vas deferens, which is dumping the viable sperm into the ejaculatory duct. The next structure to identify is the prostate gland. Again, I'm going to put the model back together and then remove it. The prostate gland is this gland right here. You can see that externally, and disassembling the model, we can now see it internally. If you notice, the prostate gland is receiving fluid from the vas deferens, viable sperm, through the ejaculatory duct, as well as allowing urine to pass through via the urethra. Spermatic cord I've identified already. So this is the spermatic cord here. Seminiferous tubules are not viewable on this model. The seminiferous tubules would be found within the testi. The majority of the tissue of the testi is made up of tiny tubes called, or tubules called seminiferous tubules, in which sperm develop through the wall of the seminiferous tubule. Once the sperm are formed, they are going to be deposited into the lumen of the seminiferous tubules and then be carried to the epididymis and then eventually through the vas deferens or the ductus deferens.